for bringing her on this particular episode where we're creating awareness and knowledge. It's all about we will try to create this awareness in a way where it's easy to understand. It is for simple people, not a lot of jargons which we will try to crack that. And Shrenik sir is a best example where we can kill cancer with a smile. I mean, he is the right person, right example for that. So I would like to take the privilege of asking Mr. Shrenik sir to introduce Dr. Mona for bringing her on this particular show. Over to you, Shrenik sir.
Thank you, Ravi. Good evening, friends. And I'm having a very huge privilege of welcoming Dr. Mona Namancha. We have been knowing each other for quite some time, and she's gynec oncologist, and CRS HIPEC expert, and currently she's with the GCRI, that is Gujarat Research Cancer Institute. This institute is one of the oldest and premier institute of cancer research and treatment in India since 1962. One more point I would like to mention that most of the oncologists or other cancer specialists, they start their career at GCRI, that is Gujarat Research Cancer Institute, and that is where Dr. Mona is performing surgery every single day, and she has played quite important role in saving life of many. Is one of the important aspect and specialty about Dr. Mona is, like the female having malignancy during the pregnancy, that she is treating in a very wonderful manner, and that is the best part, and one can take benefit of that. And I am proud to say that she is the only gynec cancer oncologist in Gujarat who has been trained for this specific procedure in Gujarat. So very warm welcome to Dr. Mona Shah. That is one more point I would like to mention this evening. Where the women community, they are doing excellent spectacular role globally, and therefore I chose this specific topic of gynec cancer so that too many women get benefit of the knowledge, information about gynec cancer awareness, treatments, and etc. So once again, warm welcome to Dr. Mona Shah, and thank you for being with us. Over to you, Ravi.
Thank you, sir. So maybe Dr. Mona can start talking about gynec cancer and what causes this. Maybe we can create that awareness today with simple examples and with a lot of simplicity, which a common woman can understand. And people like me, husbands and brothers out there, or parents out there who can understand and ensure that we know how it is caused, what are the risks involved, what are the prevention factors so that it doesn't occur. We don't want any family member to go through these issues, and what are the treatments that are available. So over to you, Monaji.
Thank you, Mr. Shrenik Shah. Thank you, Mr. Ravi and WurkTV for having me here. Yes, thank you for the introduction. Yes, we are here because the cancers, many cancers, they can be prevented in female. And if cancers are diagnosed in early stage, the suffering from cancer, the deaths from cancers can be prevented. So that is what our goal today is, to at least let people get aware of the symptoms so they reach to their doctor on time. Yes, we can start with our cancers. So what I'll be doing is I'll be talking about three more most common cancers happening in women. Next, please.
Yes. So we would like to know what are the there are different types of cancer. So what is leading, and for a common woman, she should know what are the common challenges which are happening right now, and what are the trends. Maybe you can discuss about that.
Yes, so talking about cancers, there are mainly four cancers which occurs very commonly. First ranking cancer is the breast cancer, and which accounts for the maximum death in women. Second is cervical cancer, जिसको हम बोलते हैं गर्भाशय के मुंह का कैंसर और cervix cancer. Third cancer, which is called ovarian cancer or अंडाशय का cancer. And fourth most common is uterine or गर्भाशय का cancer. So we will be talking about three main common cancers.
Okay. Moving on, some of the ladies are not aware of the terminology, especially some of these terms in English are not very familiar. They're not familiar. So can we discuss about what exactly some of these parts mean, and what are really important to be taken care of, and what are the common mistakes we do in our day-to-day life in terms of hygiene?
So as per the slide, ये जो है फीमेल जेनाइटल ऑर्गन सिस्टम है, इंटरनल जेनाइटल ऑर्गन, जिसमें यूट्रस जो कि गर्भाशय बोलते हैं, देयर इज सर्विक्स जो कि गर्भाशय का मुंह बोलते हैं, एंड ओवरीज that is the andashay. So these three cancers, and these three cancers have different type of presentation, different symptoms, risk factors. So we'll definitely talk about each one separately.
Okay. So, in terms of cervical cancer, what are the role a gynecologist play? I mean, can all the gynecologists treat, cancer, or इसमें specialities होते हैं?
So basically, so all gynecologists may not be able to treat all cancers. Gynec oncologist is someone who's specially trained for dealing with various types of female cancers.
Okay. Can we now talk about ovarian cancer? What does this mean, and what are the precautions that we need to take care?
Yes, we can move to next slide. Ovarian cancer basically is the deadliest of all cancers. Reason being, its incidence is low, but it doesn't have many symptoms. So when patient reaches to doctor, most of the times, almost 70% times, they reach in advanced stage, stage 3. In 2020 in India, we are expecting 40,000 cases, new cases of ovarian cancers will be diagnosed, and out of that, 27 to 30,000 women die. So you can see the severity that more than 60% patient dies of ovarian cancer. Reason being because they present to doctor late in stage 3. It mainly affects older women, 50 to 55 years of age, and it's the sixth most common death occurring all over. But in female, it's the deadliest cancer.
Okay. So, what are the factors, and what are the risk factors that are involved, and how can we decrease it?
Yes, so many a times when we tell diagnosis of cancer to our patient, first question she will ask, why I didn't know I have a risk factor to develop the cancer. So yes, there are few things you have to keep in mind. Like if you are overweight, if you are you have habit of smoking, all alcohol ingestion. If you have family history of cancer, especially if you have any family member with history of breast cancer or ovarian cancer, you are at very high risk of developing this type of cancer. If you have late pregnancy or late childbirth, which is very common nowadays because female are career oriented and they conceive later after 30, so which is also a risk factor. If you have early menses or if your menses is not stopped beyond 50 years of age, if you have late menopause, that also is a risk factor. If you have other ovarian cysts, like most common is endometriosis. I'm sure many of the women knows what endometriosis is. So if you have endometriosis, yes, you are at risk. If you have infertility, जो बच्चा नहीं होता है, infertility का treatment करना पड़ता है, so that is also a risk. And if you have genetic risk, if you have family history, so all these are risk factors. But yes, if you have childbirth, if you have breastfeed your child at least for 2 years, if you are taking birth control pills, that all gives a little protection and it decreases risk from ovarian cancer.
Okay. What are the early stages of symptoms? How do we detect this?
Yes, so as I told you, ovarian cancer is very notorious cancer. Reason being, it doesn't have very specific symptoms. It gives very vague symptoms like tiredness, frequent urination. If you are eating little bit and you are feeling full quickly, if you have bloating sensation, if you are having indigestion, your bowel habit changes, whether you get constipation or whether you have to pass bowel very frequently. If your bowel habit is changed recently, you have to consult your doctor. So it has very vague symptoms. And as cancer advances, then you have water collection in abdomen. So you will have abdominal distension, mass, pain, and by the time you are already late once you reach. So all these non-specific symptoms, एक महीने के अंदर, within a month, if you have all these symptoms very frequently, then you should consult your doctor. Many a times we have seen patient says कि gas हो रहा था, so he didn't go to doctor. But if you are having those problems frequently, you should not neglect it.
Okay. So, are there any tests which can be done, and at what age do you recommend these tests can be determined, if there are any?
Yes, so ovarian cancer as such doesn't have any screening guidelines because most commonly 90% it happens sporadically. 10 to 15% of ovarian cancer happens in heredity. As I said, if you have family history, I'm not sure whether you have heard about Angelina effect. She had family history and she did her genetic testing. That is called BRCA genetic testing. So she got tested for it and she came positive for it. And so to prevent cancer, she did surgery. She has removed her breast, she has removed her ovary, so that later in life she doesn't get cancer. But this happens only in 10% of cases. 90% cases may not have family history. And so there are no screening guidelines. But yes, as I mentioned about your risk factors and your symptoms, if you have all this, then you should consult your doctor. And then, according to your symptoms, doctor will advise tests like something called ultrasonography. There are some blood tests which are done, and depending on if you have ovarian cyst, then doctor may advise MRI or CT scan. So these are the investigations usually done depending on your symptoms and your clinical checkup by doctor.
Okay. Anything that we need to take care before we move on to the next type of cancer? Any other topics we need to cover? Awareness.
So I would like to mention about treatment part of ovarian cancer. So if you are detected with ovarian cancer, the treatment is usually multimodal treatment. That means it includes surgery and chemotherapy. So sometimes if cancer is advanced, then doctor prefers to give chemotherapy first, which is usually done cyclically. Every 21 days cycles are given. Once your chemo is over, then surgery is done. And after surgery, 3 more cycles of chemo will be given. So it's a multi-theme approach. Your gyneco-oncologist will assist in your surgery, chemotherapy doctor, medical oncologist will be involved. Yes.
Okay. Can we move on to the cervical cancer? What are the, what is the effect on it? How serious it is?
Yes, so cervical cancer मतलब कि गर्भाशय के मुंह का cancer, which is most common after the breast cancer in India. You can see 1 in 50 women, which is a very high incidence. And unfortunately, a lot of women dies of it. Again, the reason being reaching to doctor late. But a good thing about this cancer is this is completely preventable cancer. So there are vaccines available, there are tests, routine checkups available. If you follow those, you can completely prevent this cancer.
Okay. Can we talk about the risk factor that leads to this?
Yes. So cervical cancer mainly happens because of infection called HPV virus infection, and which is usually sexually transmitted. So yes, if you have early onset of sexual activity, if multiple partners are there, or if your partner is with multiple partners, these are the most common risk factors for cervical cancer. And yes, if you are on any immunosuppression drugs, if you have multiple pregnancy, many childbirth, and this is also related to infection and hygiene. So, barrier contraception, using condoms and preventing sexually transmitted infections prevent this cancer also.
Can we talk about some of the facts which are related to this particular cancer, and what are the symptoms? How do we detect this?
Yes, so usually cervical cancer affects early age group. It affects 30 to 50 years of age group females most commonly. And most common symptom is irregular menses. If you are having menses not cyclically every 10 days, 15 days, if you are getting menses, you should consult your doctor. Another most common symptom is presenting with white discharge. बहुत सारे फीमेल्स बोलते हैं कि बहुत पानी गिरता है, but then they neglect it thinking it's a common symptom. So no, if you have white discharge which is blood stained, which is foul smelling, you should consult your doctor. And third most common symptom is bleeding after sexual activity. These three symptoms are very classical symptoms of cervical cancer. Rest all can happen. You can have lower abdominal pain. You can have a change in urination, frequency in urination. But these three menstrual complaints you should not neglect.
Okay. Can we talk about when can we take these tests? At what ages?
Yes. So as I said, it's a cancer which is completely preventable. So there are guidelines. If you are 21, but in India we take that guideline as 25 years of age. So if you are 25-year old, sexually active woman, then you should do tests. There are two tests available. One is called pap smear test. Another is HPV DNA test. As I said, the most common cause of this cancer is HPV infection. So if you are 25 years age, sexually active woman, you should do pap smear every 3 years. And if you are doing pap smear and HPV test together, then it has to be repeated after next 5 years. So, which is not a big problem. Many a times we see patients saying कि time नहीं होता है, but once in 3 years visiting a doctor, there is no excuse.
So, and are these tests simple, or are these very complex and expensive?
So it is very simple test. It is done in OPT basis. It is not at all painful. You can see in the picture it's very thin spatula-like thing, which which is used for the tasting. So it is not painful. Many a times patients think कि जाने के बाद बड़ा टेस्ट होगा, बहुत पेन होगा, and that's why they avoid going to doctor. So it is not at all painful. Very simple OPD. It takes just 5 minutes for the doctor to perform the test without any anesthesia required.
Cervical cancer free.
Yes. So as I said, guidelines are already there. Main is vaccine also is available. As I said, HPV infection is the main cause. So we do vaccination of our kids for all most of the diseases like chicken pox, polio. But this HPV vaccine still people are not aware of. So the guideline says 9 years to 14 years of girls, they should be vaccinated with HPV vaccine, and 2 doses are required usually for this vaccine. So if you are taking this vaccine today, the second dose will be given after 6 months. So we should definitely consult our pediatrician or our gynec doctor about the HPV vaccine. The idea is before girl gets sexually active and the vaccination is given, then it prevents the cancer in future. But the vaccine has come up recently, so it is allowed to be given even in 15 to 45 years of age female also. The vaccine, same vaccine has to be given 15 years to 45 years of age female, but then 3 doses will be required. In 9 to 14 years, only 2 doses will be required. But yes, as if any woman more than 25 years of age, even if you are taking vaccine, pap smear every 3 years is must. But if you follow these guidelines, the cancer can be completely prevented, and the data says that we can prevent 80% of death, which is really amazing if we definitely consider doing this, following these protocols.
Yeah, that's true. So, what are the treatments? Let's say, God forbid, and somebody gets this. So, what are the treatments available to, take care of this?
So, cervical cancer has, if you come to doctor early in stage, then only surgery would suffice. So, usually up to stage 1, and there are something called pre-malignant lesions of cervix. So, this can be cured only with surgery. But if you reach to doctor late after second stage, then you need radiation and chemotherapy. So as the stage advances, the treatment also increases, the side effects of each treatment also increases, and definitely the survival, getting chances of cure of cancer decreases when the stage advances.
Okay. Thank you, Monaji. Can we also talk about uterine or endometrial cancer? And what are the impacts of this? How
So you
how dangerous is
so
this?
uterine cancer is different than cervical cancer. सर्वाइकल कैंसर था कि जो गर्भाशय के मुंह का कैंसर, यूट्राइन कैंसर जो गर्भाशय प्रॉपर है उसका कैंसर. So we have seen the trend increasing of the endometrial cancer. Reason being the lifestyle basically. So sedentary lifestyle, obesity, that all is now causing increase in incidence of endometrial cancer. And in India, we are expecting in 2020 14,000 new cases, and the death around 5,000. So good thing about this cancer is it usually gets detected early if you uh, take care of your symptoms and if you reach to doctor. So almost 60-70% cancer is presented to doctor in early stage.
Yeah, we can discuss about who gets infected, who are at higher risk.
Yes, so endometrial cancer usually affects older age group. So 45 to 65 is the age group usually which is affected. So if you belong to that age group and if you have this risk factors like if you are diabetic, if you are hypertensive, if you have history of infertility, pregnancy नहीं रह रही, if you started having your menses early, that is called early menarche, or if you are having late menopause, like 50 years के बाद अगर menopause नहीं हुआ है, there is something called PCOS. I'm sure many of the women will be aware of. जिसमें ovaries में multiple cysts happen. So if you have PCOS, if you have family history of endometrial cancer, if you have thyroid disease, or if you are on some drug, especially breast cancer patients are put on some hormonal treatment or tamoxifen drug. If you are having any of these risk factors, there are chances of developing endometrial cancer.
Okay. What are the trends now? Maybe can we discuss about the trends? I mean, is this very frequent? Is this increasing?
So endometrial cancer is a common cancer, definitely less common than cervical cancer. Every year we are seeing increasing trend. As I mentioned, it is mainly related to lifestyle disorder like late pregnancy, sedentary lifestyle, diabetes, hypertension. So yes, incidence has increased from previous cases, and we can talk about the symptoms basically. So there are two main classical symptoms. One is post-menopausal bleeding. So if you have got menopause, if your menses has stopped for 1 year at least, and then if you start having menses again, that is called post-menopausal bleeding, which is a very classical symptom. So many a times this older woman neglect that symptom. So you should not. Another is bleeding irregularly. If you are getting heavy periods, painful periods, if you are getting bleeding every 10-15 days. So many a times at 40-45, women think, yes, I am about to get menopause and maybe the symptoms are due to this. But usually it is not like that. So you should not neglect these symptoms. We have seen female neglecting these symptoms thinking it is a normal pattern, but it is not.
Okay. Any specific reason why it's mentioned black women are twice more likely to die?
There are no specific reasons, but it is seen in various studies that black women gets affected more, and maybe they approach to doctor late. Maybe it is related to racial preferences and maybe the education level. But yes, they have observed that it is because mainly they present to doctor late, so the advanced stage, and that is the reason of more deaths among like.
So, can we talk about the diagnosis for this particular type of cancer?
Yes, so as I said, there are very classical symptoms, but most of the times females are worried that once we'll go to doctor and what all tests will be done, and that's why they don't approach to the doctor. So let me tell you, it's very simple. OPD based tests are done. No anesthesia is required. It is not painful. Doctor usually takes your history. They'll see whether you are at risk, and there is something called endometrial biopsy. So in previous times, usually patient has were anesthetized and then BNC, curative, जो हम बोलते हैं कि बच्चेदानी सफाई करते हैं. So all that was happening in the past, but now with the latest equipment, it is done in OPD basis, a simple sampling like pap smear without any anesthesia, without any pain, it is done.
Okay. We spoke about a lot of cancers. So, how do we prevent some of these things? What are the common things we should take care in our lifestyle so that we don't get into this situation?
Exactly. So yes, as I said, among these three cancers, one is the cervical cancer, which can be completely prevented with timely vaccination, timely pap smear. So that is the one cancer which can be prevented. The other two cancers, ovarian cancer and endometrial cancers, are usually associated with lifestyle disorders because it is observed if you have diabetes, if you have smoking, ingestion of alcohol, if you are obese, there are chances of getting more risk of these cancers. So, of course, you have to avoid alcohol, smoking, maintain ideal weight, avoid obesity. So, do exercise, uh, at least regular checkups by doctor. That all should be done. So, we always talk about prevention is better than cure, and it definitely works for cancer as well.
Yeah. I think the screening is very important. So, we discussed about what ages they should go for tests. I think this will make a lot of difference.
Yes, so we didn't actually discuss about breast cancer in detail, but yes, these two female cancers, breast cancer and cervical cancer. So breast cancer ranks first in the female, second is the cervical cancer, and luckily both the cancers are completely preventable or at least can be diagnosed early in stage if you follow the guidelines. For breast cancer, the guideline says after 40 years, every 1 to 2 years, you have to do mammography and you have to do something called self breast examination. So, yes, these cancers can be prevented. So I would definitely say कि yes, female has that habit of taking care of all everyone, especially now even working women. So the excuse always is कि time नहीं मिलता है. But I would say कि make yourself priority. Don't neglect your symptoms. I'm uh, hopeful that this factors and the symptoms which I mentioned, if you have any of this, consult your doctor, maintain healthy lifestyle, and yes, visiting your doctor regularly. Once in a year, consultation with a doctor definitely doesn't take a lot of effort and a lot of time. And nowadays, it's like appointment based system also. So make yourself priority. That is first thing. Second thing is share with your whatever problems you have. Share with your partner. Share with your family members. Many a time we have seen because many cancers occurs in older women, so they don't share it. So at least talk to your daughter or someone who you are close to, and just at least mention them that you are having some symptoms. So at least they can guide you what to do.
For women, how much is the percentage related to the hygiene factors? Not there are a lot of people who are still in rural areas, गांव में रहते हैं and all that. How about the hygiene factors? Does any of those have impact on this, or do you feel overall this is more of a urban disease because of our lifestyle and the way we are living? So what's your personal take?
So yes, the cervical cancer is observed more in rural group of women. Reason being, it is associated with infection. So hygiene definitely plays important part in cervical cancer, and the literacy. Even so, that is mainly related to hygiene, poverty, infection rates. So we have seen poor people affecting more with cervical cancer, whereas endometrial and ovarian cancer are more in urban group because of their lifestyle mainly.
So, and what percentage of this, or how important is a weight of a woman? Because that seems to be a biggest task in everybody's mind. That I'm overweight, or I'm not able to reduce. they go with a lot of alternatives of weight reduction. So how much of this has related to, what are the chances of they getting cancer if they are overweight more than what's recommended?
Yes. So many times the female are over conscious about their weight. They want to achieve maybe zero figure, and so it is not the goal. You have to have ideal optimal body weight. Obesity definitely has more risk of developing cancer. The mechanism I would say is mainly because the fat, when it gets degraded, it produces female hormones called estrogen, and which is a mechanism of developing cancer, ovarian and endometrial cancer. So
Okay,
that is the mechanism behind obesity. So yes, maintaining ideal body weight is necessary, but do it with a proper way. I mean, eat healthy, do healthy exercise. Uh, that is what
that
is
is it.
required.
Yeah. It's shocking to hear, one of the points which you mentioned was, with respect to late marriage, or, they're having, kids late. Now, a lot of people are, moving towards settling down first, अपना घर बनाएंगे, settle, career में settle हो जाएंगे, and then let's have kids. So will this have an impact on the overall, the way the body behaves and the natural structure?
So yes, it is observed. As I mentioned, it's a lifestyle-related disorder also, cancer. And yes, they have observed with late marriages and especially with late pregnancy, there are chances of increased ovarian and endometrial cancer. But yes, so I would just like to mention with this key, yes, you have to balance your career and your health and your priorities. I don't want to talk like mummy that get married first and get settled first. No, I would definitely tell girls
You have
to
to have
get
equal
settled
balance.
first. Yes, concentrate on your career also, but yes, your health is also important. So you can actually talk to your gynecologist. There are many options. They can give you, if you have risk factors, they can give you some oral contraceptive pills like hormonal pills. If you are at risk, they can guide you with some screening strategies. uh, there are increased risk of infertility uh, with delayed marriages. So there are options available that you can freeze your eggs so that later on you don't get infertility. So yes, if you are career oriented, it's good. Then you take help of your doctor; they'll guide you better.
Okay. So, with respect to, we were talking about hormones. How does the mental health or the stress on a woman has an impact on some of these things? Because आजकल stress बहुत है, and especially, when you join a corporate and all that, the traffic and, reaching the work, the pressure at workplace, and then, back managing these multitasks. How much would this might have an impact on the overall health?
Again, I would start with one same sentence that it's like a lifestyle disorder, like a diabetes, like hypertension. So stress definitely has effect, and the stress basically causes oxidative damage to body cells, and this damage in turn, when it gets body tries to repair it, that cell repair mechanism sometimes gets disturbed, and it can cause cancer. So yes, stress is a cancer risk factor for developing cancer, and it's unavoidable. But yes, again, it then comes to lifestyle modification. Do meditation, maintain healthy lifestyle, do something yoga, music to reduce stress. Yes.
So that's all the questions I had from my side. So, Shrenik sir, would you like to add something?
Uh, yes, by the way, there is one question from patient Tricha on our Facebook. Kindly address that. And Dr. Mana, I would like you to speak about the treatment part of the pregnant woman during malignancy. So that will be that is rather very important part to be taken care of.
Yes, so I would first address your question of pregnancy with malignancy. So in pregnancy, breast cancer is the one which is very common, and again it depends on the stage, at what stage you are diagnosed. So if it is early stage of breast cancer with pregnancy, then yes, surgery can be done. Usually surgery, and if chemotherapy is required, then it is done in second trimester of pregnancy. That is usually after first 3-4 months of pregnancy is over. So that time the baby's organs are forming. So chemotherapy and all can damage and can cause defect in the child. So once these 3-4 months are over, we can give chemotherapy, and but we can do surgery also. We have to weigh balance. The management totally depends on the week of pregnancy, your stage of cancer, and it's a very complicated process. So we have to many a times take priority. If cancer is advanced and it is just early pregnancy, just 1 month of pregnancy, then we have to decide priority. Definitely, women's life is more important at that stage when it is advanced stage cancer. So, breast cancer is the one which is very common. There are many ovarian tumors which happen in pregnancy. Many of these ovarian tumors are not even malignant. They can be simple or benign tumors, but which need surgery. So it can be done in second trimester again. Third cancer which we talk about during pregnancy is usually garbhashay muka, cervical cancer. So again, the management depends on the stage of the cancer and on the gestational age, whether pregnancy is early or it is already 8-9 months of pregnancy. Then we decide accordingly and prioritize.
Okay. Yeah, I cannot see any questions from the audience. Sir, have you come across any questions?
Well, there is one from Trisha.
Somehow, yeah. Can
Do
you
you
ask
want me
that?
to? Yeah. Well, Trisha, this was saying, I have been recently diagnosed with follicular thyroid cancer with an aggressive histotype. Underwent hysterectomy back in 2020, and now on thyroxine 25, and she has 5.5-year-old baby. Can I plan for a second baby? She is 36, and is there any vaccine available for to prevent cervical cancer?
Okay, so first half of the cancer question, thyroid cancer. So definitely, Trisha, I can't advise the whether you can plan pregnancy or not only based on this question. Definitely I need to see what stage was the cancer, what surgery was done, what was the final biopsy report. So I guess I won't be able to help you much through this online video only, that whether you can plan pregnancy, but I can say that much, yes, you can consult your treating doctor, and if your cancer is early stage, if it is cured, if your thyroxine supplementation is okay, if you don't have any other cancer in the body, then you can have pregnancy with thyroxine support. Involvement of your oncologist and a good gynecologist will help you. But yes, you can plan pregnancy. So that is the first question. Second half of vaccine available. So yes, we talked about it. For cervical cancer prevention, HPV vaccine is available. There are 2-3 brands which is available in India. And yes, if you want to give it to young girls between 9 to 14 years of age, then 2 doses of this vaccine is required. 15 to 45 years of age group female also can take this vaccine, but then they will need 3 doses of vaccine.
Thank you. Thanks a lot, Monaji, for addressing some of these questions, and the overall awareness of these cancers for women, because some of these things are most neglected, and the common perception is that when it comes to gynecologists, it's only certain limited it's only menstrual health that comes into the mind, but not beyond that. So thanks a lot for sharing your insights, and some of these slides are very worrying. But yeah, again, uh, we want to create the awareness, we want to create knowledge, so that we take the proper precautions, so that we don't get into this stage of diagnosis. And some of these preventive actions of some simple tests, based on the statistics, some age categories have the tendency of getting this cancer. So since we know the age category, it's better to take those one or two tests which will avoid or prevent this particular occurrence, and make sure the family is going happy as ever. So yeah, that's all I would say. Shrenik sir, would you like to
Yes, I would like to add that Mr. Shrenik is a live example that we can conquer cancer definitely. Cancer doesn't always mean cancel. So yes, that when we tell about the diagnosis, it's definitely devastating, depressing for the patient. But yes, you have to keep faith. You have to follow your doctor, and you can definitely overcome. But I would definitely again say there are cancers which can be prevented. First, prevention is always better than cure. So we have to definitely talk about preventive oncology as well.
Thank you, Dr. Mona. So Shrenik sir, maybe some thank you
Yeah,
note before we.
yeah. No need. So, Dr. Mona, thank you so much. One of the key reason of conducting this educational presentation today was definitely for women who are into professional career, and they may not be having much of the time. So we wanted to have that awareness, and if something goes wrong, they get timely diagnosed treatment, and at the end of the day, they can go back to the work. So this was the purpose of this presentation. So thank you once again, Dr. Mana. It was pleasure welcoming you once again. Thank you.
Thank
Thank you,
you.
Dr. Mona. Thanks a lot, friends. Again, prevention is better than cure. Spread this word out. Let all the women around you, including your spouse, sister, mother, everybody go through this particular video, so that they are at least aware of how it happens and what are the things which we can do to prevent it. Thanks a lot for joining in. Thanks a lot, Dr. Mona, and thanks a lot, Shrenik sir, for this particular initiative. God bless you all. Have a great
Thank you.
evening. Thank
Bye
you.
bye. Bye.